into. All right, so here we go. So I'm so excited you said yes to having this chat with me today. I think I've been curious about your organization for a long time where I see the videos, I see
Mhm.
the different things you're doing, and I'm just like, do I really know what's happening? But I'm excited that you said yes. And so I want everyone to know you are the founder of Enhanced Black Women's Health, which is a beautiful thing. I feel like your mission is already in the name. So, which is
Yes.
a beautiful thing. So tell our listeners and viewers like who you are, but don't focus so much on like the stuff that they can easily find. But it's like, who is Tomesha?
Yes. Well, first of all, thank you, Marie, for agreeing to chat with me because this is so fun. I adore you 100%. So I was like, of course, I'm going to chat with you. But when I think about who I am, starting off with Enhanced Black Women's Health is probably one of the better examples of it because years ago, I got diagnosed with rheumatoid arthritis and Sjogren's syndrome. And mind you, this was years after kind of dealing with all of these random symptoms, and I just couldn't like pinpoint what was going on. And after I finally got that diagnosis, you would think like, okay, this is where the journey begins. And it is where the journey began, but in such a different way because it opened my eyes to our healthcare system. Like previous to my diagnosis, I rarely visited hospitals, like maybe an emergency room visit if I got food poisoning, but I just had very limited experience other than my grandparents who were, unfortunately had diabetes and glaucoma and things like that. So my experience was really, really minimal with the healthcare system. But after getting diagnosed, I spent months and months and months going back and forth to these different appointments. And it was so interesting being in a healthcare system where, in the United States, and it not being the experience, in my opinion, that it should be, especially for Black women, having those times where people would disregard your concerns, wouldn't answer questions, being in a system where at times, people would gaslight you. So it was like going through that experience is really what transformed what I wanted to do. Previous to this, I was a health coach and it was all focused on what we can do to change our lives. And I still don't dismiss the importance of like proactive steps as individuals. However, what I'm focused on more now is how can we work with the system and then how can we improve the system because there are a lot of systemic issues that are contributing to healthcare disparities. And that's something that, in my opinion, is not spoken about enough in the United States, around the world, but especially in the United States.
No, it's the more common the issue is for some, it's almost like the more it's buried, for lack of a
Yes.
better word. And we have something in common where I started almost like my official job as a health educator in women's health. And it was so
Mhm.
interesting because I didn't study it. It was something where, again, our lived experience is always almost like a guiding light sometime in terms of
Yeah.
what we choose to do down the line or what we choose to do for work. But being always in the seat where we're the one helping, educating, informing, and teaching others how to advocate for themselves, when you're in
Yes.
that seat, it's so different. Because I remember having the same experience with a different health issues where you keep going back and forth. There's no diagnosis. You keep
Mhm.
prescribed things, and people no idea what you have. But then, even recently, I've wondered there are certain once you know sometime. And I remember it's almost like we self-diagnose ourselves. I was sitting
Yeah.
in a presentation and I'm reading it because I prep these things to do
Mhm.
professional development for clinicians. And so I'm
Yeah.
reading the slides and it's a health hazard. It's a hazard of the job when you think you have every disease that you presenting. And so I'm
Yes.
like, as I'm reading the thing, I'm like, is that me? Because these people couldn't figure out what I have. And I'm reading it and she's a black she's a doctor in
Yes.
OT, and I'm like going. Then I'm like, oh, I think that's what I. And then I literally took the time to say, hey, you know what? I think I need to see you because all these people couldn't figure it out, but I think this might be it. And it was just like, it was almost like I don't know if I would have discovered that if I wasn't in the field itself, where I have access to experts versus
Mhm.
someone to now. And we see those commercials like, tell your doctor about this. And I'm like, people don't usually tell doctors what they have, but we do know our bodies enough to kind of be
Mhm.
like, that's not right. I'm not feeling the way I should be feeling. And so I think that's a whole process where, I'm glad you didn't dismiss your experience because sometimes we sort of downplay it because they downplay it.
Yes.
And we just like, maybe it's in my head. They say that all the time. It's in your head. Even pain. People
Yes.
don't treat all pain in general, whether it's like that whole
Mhm.
pain physically, medical things where you could say like I'm a 9. Every time I go in, I'll be like, it's 9:10. And I'm thinking, if it was a different person, would they have approached that individual differently? Would they still think you can still go about your day the same way,
Mhm.
constantly dealing with that issue? And so for you, creating this, is this something that has been embraced, or have you found resistance from clinicians for you to, to have your organization, in terms of, it's definitely an urgent need, but sometimes that need, not everybody see it as urgent as you do.
Yes, and this is the interesting part is that I haven't actually experienced as much resistance per se from, at least not from the clinicians specifically, or even like health coaches or people in the health industry, because of the way it's titled. I
Mm,
think there's also this assumption that I'm only speaking to other Black clinicians or nurses and, personal trainers and stuff. So I've had to really navigate messaging and helping people understand, no, 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 this is a conversation all of us have, irrespective of you're part of the Latinx community, Asian community, whites. Like, this isn't just specific to Black people. So I think that's probably been the issue there, where it's not a resistance, but some people just make the false assumption that this is a you problem and this is the them thing, not a this is a us thing.
Austin, yeah. And that, I think that's across the board, because I remember we even did something even within women's health as a whole, without even breaking down the demographics. Because even if you had said enhance women's health, and you're like, who, which
Yes.
women are you talking about? Because it's not necessarily all when we say
Nope.
that one word. And
Mm-hmm.
so sometimes we think we're being inclusive by being general, right? It's like, I'm not going to offend anybody because I'm not,
Mm-hmm.
no one is left out. But I'm like, you do leave people out even when you specific. And so communications with clinician is always interesting, or providers. And I think sometimes people think they are. And even language that they choose to use. Sometimes, when, even if you're knowledgeable, I go in and I'm like, I don't know what this person told me to do. I don't know what they told me I have. It's almost like I wish I had a health interpreter, if such a thing exists. Like, it's a whole
Yes.
different language. I'm like, what did you say to me? Or what do I have that I left with more clarity of like my issue? And so, what is the one thing you feel like your organization is teaching clinician, who are still human being, we're still giving them grace in terms of they don't have to know everything, but is that one thing you wish, whether they just come out of med school, whether they're just starting out, that they can do as a way to do that piece in terms of enhancing Black women's health?
I think the biggest piece that I found, and this is based on research, is that there's so many systemic issues present in our healthcare system that people have to realize that when we think about like implicit bias or we think about racial bias, those are parts that are embedded in the system. So often people try to just stay with what has been done forever without realizing you're working in a system that in and of itself is racist. And
Mm,
that bothers people because they're like, well, I'm not racist. Like, no, you may not be racist, but the system in and of itself is racist. Like, for example, when we think about Black bodies, when we look at things like the BMI scale, which is a whole
mm,
different, in BMI index, body mass index, which is like problematic in and of itself. If you dive deep into how it was created and the fact that it was used a very small sample of white men from Europe, and then B, was created by someone who was a statistician, not someone who was even in the health field. It was like, this was never created with Black people in mind,
mm,
yet this is how you are trying to measure Black health.
right.
That in and of itself is a systemic issue. And if you're utilizing that as a basis without recognizing this is a statistic that actually does not apply to Black folks, but this is a statistic that you're using to determine our health, that's a problem. So it's like helping people understand some of the measures that we've clung to as a healthcare providers is in and of itself problematic, is in and of itself harming health because it doesn't look at everybody. It's not inclusive and it never was meant to be.
Mhm. Yeah. Yeah. And that's tough, because I think sometimes we also assume if we look the same, I
Mm,
automatically get the issue. Where sometimes I see some people think like, we get a pass because we're a woman, we're going to be empathetic, or because we this,
yes.
where everyone, regardless, this is something that should be learned. And I don't think it's, people are learning it, whether it's like coaching, whether it's in medical school, nursing, whatever it is, where you literally have to learn it. And even if you think I think there are ways for you to sort of be conscious about it, in terms of, how can I be a better provider? How can I be just improvement as a whole, in terms of making sure, because when you see a lot of things we do, the main goal is not just to sort of like, let's provide a service, but like, I'm hoping people are not doing additional harm. And I think we, as a group, we already harmed every single
Mhm.
day. Like every environment that we in, there's something that's literally working against us. And so for people to think like it's something we all have to work on. So even if, again, it's like you learning it, like you went, you're getting training, you're learning more versus like just like on experience. And then to teach others in terms of how do we learn together? Because I'm sure now there are cases, and I'm seeing providers with who shock me, who do it better than who I thought should be doing it better.
Mhm.
But that's because they took the time to learn it, because a lot of things people would tell you, and you know this probably with nutrition, with
Yes.
fitness, with everything else, most did not learn this in school, right? So it's not even a thing where you're saying like you should know.
Yes.
Even basic thing like when you think of like nutrition, like we're talking BMI and so many different things,
Mhm.
people don't even learn about nutrition. Like you may go in for all these issues, and most will never talk to you about what are you eating, anything stressing you out. These are the questions
Yeah.
versus going directly into like this diagnosis that's so, I don't know, it just seems like very broad versus like things that are like day-to-day basic that the person might be doing. And then also then you add the cultural piece that I think I've
Yes.
seen in one of your videos where it's completely lacking, where it's almost like a one size fit all, even though we know one doesn't. And so
Mhm.
so for patients themselves and women, what can they do going in terms of not assuming the provider knows it all? Because there are instances where culture, I think people see, especially doctors and other people in that field, as almost godlike. They know
Yes.
everything. Whatever they say is final, versus we already have agency, but how do you encourage women to sort of say, you have the power to share your issues, but also you don't have to take everything that they tell you, and that if you're being treated a certain way, that they have the right to expect better.
Exactly. One of the things that I found really helpful, and this is with one of my doctors, because often you touched upon this earlier, we get asked the question, do you have any questions? And it's not necessarily that we don't have any questions. We don't even know what question to ask. And one of my doctors, he asked me this, and I just looked at him. I was like, well, if I were you, what questions, or if you were me, rather, what questions should I ask? And he just kind of took a step back because he wasn't expecting me to say that. But I was like, I don't actually know the questions that I would ask. What questions should I be asking about my condition? What questions should I be asking about follow-ups? And he actually, from that, started breaking things down. I'm like, well, this is some things to consider. And that was very helpful. And it helped us create like a better relationship with him understanding, like, I don't understand what these conditions are. I didn't go to medical school. I don't know anything of this. So it's like, I know what maybe I read on PubMed, that's about it. So that's kind of one thing. But then the other thing to your point is when you are dealing with a doctor or really any healthcare provider, because I don't want to say it's always physicians, but if you are dealing with someone in a healthcare space that disrespects you, feeling comfortable to go to the next person above them to have a conversation. Like, yes, you can have that conversation with that person directly, but if they are not receptive, then sometimes it is filing a complaint. And that's what I unfortunately had to do with one of my doctors, because my physician as well as the assistant were very disrespectful to me and refused to do something that they actually were required to do. So I had to unfortunately go to the hospital and say, like, I'm going to go to a different doctor moving forward. I need this to happen, but I wanted you to know this is a situation. This is exactly what happened. And I hope maybe this person, improves better in the future. So it wasn't me trying to like get them in trouble, but it was helping the system understand like this is a broken piece of it. And you can continue being this broken piece, or you can actually take some proactive steps to like change it.
Do it. Yeah, I mean, and it's great when you feel comfortable doing that. And I don't think people know. On the
Mhm.
other hand, it's also, don't see it as complaining, right? So sometimes people see
Exactly.
having a complaint versus, because we don't know the experiences. And I think a lot of
Mhm.
individuals don't change because I think they do expect people to be quiet and not
Yeah.
say anything, because most people don't. Especially when you're thinking about culture or certain groups. And again,
Mhm.
if you're seeing these individuals as so revered,
Mhm.
regardless of how they treat you, but that doesn't give them the right to treat you that way. But some people would feel like, I don't want to start any trouble and not say anything at all. And so knowing, just simply reporting it. And I can see that's a way, if depending on the setting and the institution, that's an opportunity for training and to address certain things that may even be bigger than starting trouble. That might be real trouble in terms of something harmful happening to that patient because of their lack of care or their lack of
Mhm.
just not paying attention to certain things, which I know people do a lot, especially when you think of the medical
Yeah.
institution where they wait until something happened versus when now I feel like when you're reporting it is a way of preventing it from happening to other people, where they can do something to improve their own system. And so the patient have a role, the clinician has a role. And so what do you think about to each other? Because I know there's a lot of issues that we face. Again, we face it in silence because we think we should know better. Sometimes it's an older generation, but I still see this generation as being almost there's shame in certain health issues that we face, whether it's mental health, whether it's other diagnoses that we have. So, what would you say to someone who feels like this is my issue? Nobody needs to know I'm going through this because I feel like if I had known certain things, if other
Yeah.
women, whether in my family or my circle of friends, would say
Mhm.
like, I went through this. Like, there's certain things I'm tests I have to go through now, and I'm asking, like, have you ever had this done? What
Yeah.
happened when you go in here? Because a lot of things that's happening sometimes to us, I always think it's an older people problem. Like
Yeah.
particularly even the condition you mentioned you have, where I'm like, I shouldn't be dealing with all this, situation because I thought I would have to be 60 and
Yeah.
over to deal with them. But a lot of issues are happening at a younger age. And so, how do we either support each other or share our stories more so we know what's happened, even if you're not sick? Again, I tell people all the time, you don't have to
Yeah.
wait until you're sick to be able to listen to others and know like what's going on in our community.
What I found to be really helpful, especially to your point, if you are a part of a culture where you don't necessarily feel comfortable sharing with people because they may be a little bit more dismissive, or even there's a tendency, which is understandable, for people to be more resistant to traditional medicine, or at least resistant to conventional medicine, but want to take more of a holistic approach. So those are opportunities where I will say, if you have access to online communities, those are great places. There's different, I mean, if you do know specifically your condition, that's helpful. Like, I will look intentionally for like a rheumatoid arthritis community or a Sjogren's community, because I know like they'll get it and understand what I'm going through. But if you're at that point before diagnosis, kind of looking into different conditions, even if you're kind of guessing, I spent a lot of time with different communities that were like gluten-free communities, and that's kind of how I got to where I am now. But the reason I bring the community aspect of it is because those are people who are more removed from you, that you
Mm,
can have very open conversations about without feeling like they're going to run and say something to someone. Because I think that's sometimes the tension that people have is, people are going to think that I'm weak, which is just throwing it out there. We are not weak because we have an autoimmune condition. We're not weak because we have a chronic condition. That's not weakness. That's a health disparity. And then two, there may be also the tendency to, if you have a lot on your plate, sometimes people put themselves last, which can become really problematic when you are someone who does have a series of health issues. If you're constantly putting yourself last because you may be the only breadwinner in a family, you may be the only caregiver in a family, but you have to remember, if you're sick, you're not going to be able to do those things anyway. So it's like it is about prioritizing you, even though that can be very uncomfortable depending on different cultural reasons and very specific, familial reasons.
yeah. Yeah, those are tough. So I know 1 year anniversary is approaching for
Yeah.
Enhance Black Women's Health. So we talked about your inspiration for starting it. So what's next in terms of what is your vision for the next year, the next five, just the next, what's next for your organization?
What's next for Enhanced Black Women's Health is speaking more. So it's opportunities like this where I get to not only educate, but have conversations with people, because I want to say that's also the issue there, is that people don't have as much health literacy. So there's like the element of communicating and educating on that. But there's also the importance of people understanding what specific resources can I seek, because sometimes you just don't know what you don't know. So that's kind of the word we're working on, is the education piece, but it's also the collaboration piece, because we do need people to understand it's not a one or the other. It is not traditional medicine versus conventional versus holistic medicine. Like, all of them can work together, and we can all work together as a system. And in my opinion, people will be better off if we all work together.
Together. Yeah. So that's a huge one when we think about sharing that more and sharing it in spaces where you don't expect it, right? So sometimes
Mhm.
we go where it's almost like everything, most of us, I think we're preaching to the choir, for lack of a better
Yes, yes.
it's like, I think they know this, but it's also like that comfort zone. So if those who are watching and listening, so what are just I stick to one because sometimes three just sound like a lot. but they're watching if they're an institution, if they're a provider, even if they are, just someone in the community. What is one thing they can do to contribute to that vision and mission of your organization?
One big thing that we can do, and I'm gonna see if I can reach to this book. I don't have it so close to me, that there's one book that I truly believe it's called Fearing the Black Body, The Racial Origins of Fat Phobia. And it's such a very empowering book. It's written by a Black author, it's written by a doctor, and it really sets the stage for understanding racial disparities in the United States and specifically around the world. So it's like, if you could do one thing, I would highly recommend investing in that book, learning a lot more about like where it all started so that we can understand this is the foundation and these are the things that we are combating and this is how we can improve the situation. Is really educating ourselves.
That's great. I think books are great in terms of where people have access to. So for
Mhm.
you specifically, so if someone is like, so speaking is one. So if they're having
Yes.
conferences, they have events, or even they have other platforms where you can come in and share more about that. And then for those who are part of, let's say, health institutional, in what ways can they engage your services for them to make sure that they're learning, but they're also making sure it's something they're investing in themselves as an institution to do better?
Oh yes, oh definitely. On specific to me, good point. They can always reach out to me on my website, enhancedblackwomanshealth.com. We do specific trainings, and the last one we just did actually was one around. Well, we actually have one coming up in the future, but the last one we did around was helping people understand cultural competency and how that's relevant to working with their clients and their patients. So if there's specific issues that you're recognizing in your organization, I'm one person that I'm happy to reach out to me, because even if it's not an area of expertise I have a community of people that I can definitely connect you with.
To do it. So I love that. So as we're sharing this, one of the things I talk a lot about is both self-care,
Mhm.
joy, and add to that is worthiness. And so for you as someone who's doing the work, what do you do to practice self-care? Like three things you do, because sometimes because
Yeah.
we're the one, again, we are doing, we're the one who's helping. And this is where also people start putting their health last, right? So because you're doing so much, you're like, oh, let me help this person, let me do this, let me do that. And then realizing you're not practicing what we
Mhm.
sharing and teaching others. So how do you consciously practice self-care for yourself?
Well, one area is boundaries, and healthy boundaries, meaning that, it's not just about saying, some people think it's just about saying no, but it's not necessarily about saying no as much as it's understanding what are you saying yes to. Because sometimes get so excited to say yes, we want to support people, but then we put so much on our plate that we become resentful. So that's like one big thing, is like setting healthy boundaries with yourself and others. The second thing is focusing on your sleep. It sounds so simple, but when you or an entrepreneur, if you're a side hustler, you're always running, 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 and forgetting about quality of sleep. I don't mean we're always going to get 8 hours of sleep every single night or 10 or whatever people need, but making sure that when you do sleep, it's quality sleep. What are the things that you're doing before you go to bed? And then the third thing, I guess, would say stress management, whatever can help you relieve stress that you experience during the day or the week, because stress is never going to go away. We live in a world that is always at war with something. So it's going to be there, but how can we mitigate it, and how can we make it easier for us to manage it when we're dealing with it?
Yeah, that's a big one. And I realized recently that's the one that's like at the core of
Mhm.
everything. And even something that's even I would say guiding my own practice in terms of when we talk about self-care, like we're talking about the solution. And I think stress is at the core. Even the diagnosis that people get, or even the one that remain
Yeah.
unknown, I'm discovering even through research that stress is at the core. Now, it gets confusing because I've met so many clients where because they love what they do, like you do, they actually think there's a lot, they won't have stress, right? But if
Mhm.
you're doing something you love, you want it to succeed, you working on it more than you would for like a regular thing for somebody
Yeah.
else, there is stress that's involved because you're worried or you have all this stuff going on. And so that's the other piece where what we think stress is, we think it's somebody's gonna look, a certain way, where I feel like stress is almost like a silent killer, almost like
Mhm.
a
It
heart
is.
disease in a way, where it's like for some people it's not as obvious, right? There's some people you can look at them and be like, you look tired, you look this, and then there are
Yes.
people who don't look like anything until something happened. And just like the illnesses, I always tell people, don't wait until you get something to
Yeah.
start practicing those things you're talking about in terms of really taking care of yourself. And before we finish, I also wanted to let people know, like your channel is also very informative where people can go, whether they're clinician or just, an individual where they're like, I need to learn some stuff where before they can even have those conversations with a provider or know what to do, because sometimes we think we know, and then you get those simple tips that you provide where you can like do these things, right? Just like you just said about sleep and then being able to set those boundaries.
Yes.
But you might be the person to remind that person to do that, even though it sounds so simple, where you're like, did you sleep? Did you do X, Y, and D? Even sometimes people ask people, did you eat? Because
Yes.
usually some of us are lucky enough to have people in our life to check up on us and be like,
Mhm.
did you do this? But it's nice even as an adult to have to still be nurtured in that way, in terms of that's a way other people care for you versus something else. And so I think that's a huge thing to really think about. And so before we go, I want to think about, people are thinking about all the stuff coming up this year. So what is for yourself? What is something that's going to be, you want to get done this year that you're working on where you're like, this year, this is going to be happening for you?
Yeah, well, the one thing that I have a goal to do is speak at 4 big conferences this year. So I've been very proactive, of reaching out to different organizations and looking at different conferences that are happening. So that's my big goal, is to get 4 speaking, engagements. Doesn't mean I'm not going to speak at other places,
Right.
in between, but big 4 impactful stages is definitely like where I'm setting my goal to be.
No, I think it's great to be so specific, because sometimes people are like, I want to speak at more conferences, and you're just like, where? And so I
Yes.
think it's great to share it. And then I'm thinking of more ways in terms of, as you know, we meet different people to sort of
Mhm.
be that connector in terms of like, you should talk to that person. And so as I'm doing this, for me, one of the things also we ask people sometimes too is like your word of the year. Do you do that? Is it like a word where you're like, this is my word to remind me that I have this goal or this intention of speaking at, 4 different places? Is there a word that says this is what you want this year to be?
Ooh, I guess if I was to pick a word for that specific, it would be impact, which I know seems broad, but it's
Mhm.
specific for me, of
Yeah.
saying like not just speaking, but speaking for impact. Like, how are people being transformed in this process?
Ooh, I love that. Impact. So that's going to be the big one. I think I'm using wow a lot.
Yeah.
Because sometimes you look at stuff and you're like, wow, that person did this. But I think I want us to look back in our own year
Hmm.
in life and be like, wow, I did this, right? Because sometimes it's so easy to look at other people and not
Mm.
ourselves the same attention. And so that will be the thing where, but sometimes it can be an acronym. I tell people sometimes it's like worthy of, and then you can finish
Yes.
whatever that is. And so a lot of the things we're talking about in terms of the idea of even the organization and the health work that's done, knowing that you are worthy of wellness, well-being,
Mm.
being healthy, right? Because
Mm.
sometimes we think being ill is normal, like we adjust to it, but also being well every day where you can move and do things and you're not in pain.
Yeah.
I would love for people to see that as something that is the normal, for you to just be able to live and be well and joyful. And so I'm grateful we had this time to chat. I'm hoping there's more for us to really
Yeah.
share more tips, as people go through the year in terms of what they can do versus something we do at a certain time of the year. Because I don't know
Mhm.
what happened after the first month, because people go back. People go back to what
Same. Yeah.
they've always done. So I'm hoping there'll be a little bit of like every month, maybe we'll do something as a reminder of like
Yeah.
3 things you can do, for you to really sort of make sure you're
Mhm.
taking care of yourself and not just solely relying on other people. So any final word for those listening, watching, that you want to leave them with today?
Well, the thing I would say, well, first was saying thank you so much, Marie, for having me, but yours, worthy of wellness, that in and of itself, I'm like, that should be the anthem for 2024, and the great
Mhm.
reminder that you are, in fact, worthy of wellness.
Yeah, so awesome. So thank you so much. I'm looking forward to our next conversation and seeing you speaking
Yeah.
at more than 4 places,
Yes, yes.
more than 4 places. So thank you for joining us today, and I'll look forward to seeing you next time.